Hi, this is Dr. Fab Mancini, and I'm so excited to have someone that is a leader in our profession, somebody that I've admired for many years, a dear friend of mine, Dr. Jeff Tucker. Hi, Jeff. How are you today?
Hi, Fab. It's great to see you, and I'm so happy that we get to be together and share this time.
You know, I tell you, I've been admiring you so much because you have such a long track record of contributing to this profession that we both love so much. We see the potential that it has, and you've been an amazing leader for the American Chiropractic Association, especially now as their president. So tell me a little bit about what are some of the basic things that the American Chiropractic Association is contributing so we can move chiropractic to what we all know is a better rightful place.
Yeah, so first I have to say it takes one to know one, and you certainly are a leader and really doing a fantastic job. And I'm the current president of the ACA Rehab Council. So within the American Chiropractic Association, we have all these different councils, the Sports Council, the Rehab Council, Nutrition, there's pediatrics, orthopedics. So within each one, you have that specialization. And the men and women that are part of our council, as well as a lot of students now, we're really trying to promote this concept of exercise as medicine. And what I love about what we're doing is it's a group that loves to blend not just the exercise, but the diet and the nutrition and modalities, and trying to really stay current with what's the latest science, and of course, like what are the doctor's experiences and our patient preferences, and putting that together to create programs for them. And I'll tell you, I've been a chiropractor for over 35 years now, and I love it more than ever. I mean, there's just so much going on. I get out of bed and it's like, can't wait to start my own exercise in the morning. That's a priority for me. Make sure that, my day is actually centered around that, right, first, and then everything else can happen, and get to the office and be with patients. And of course, it's been such a challenge. In March, the Rehab Council had its annual symposium in that middle of March, that weekend when everything just started falling apart, and there were doctors in Tempe, Arizona that were like questioning, oh my gosh, the airport's going to close down and we're going to be able to get home. And I remember saying to the group, like, okay, we are either the dumbest group of doctors, like congregating together here, and having this symposium and making sure that it happens so that we can all be together, learn together, and then go home and bring it back to our patients, or we're just all risk takers. And I think we're really, like, chiropractors are risk takers, and it's great, and I think everybody went back and, we didn't know what it was going to be like, right, for the first several weeks, to learn about, this COVID situation, what's happening in our practices, and how we would need to react for our patients' benefit. And we're so all about health and wellness, and this has gotten so far away from that, and now we're bringing that back in. As I talk to doctors around the country, everybody's getting back to work and getting their patients back in and up and running. So that's a good thing. So we have a lot to look forward to.
As president of a chiropractic school, I realized the importance of education. And the Rehab Council has done such a great job in being able to provide doctors of chiropractic more information to be able to take care of patients beyond the chiropractic adjustment, and be able to get them back to a place where they can function normally. But let's talk a little bit about, the Super Pulse laser. We both have used the multi-radiance lasers. Tell me a little bit about how that has made a difference in your clinical practice.
So lasers are remarkable. These were game changers. Early on, my experience goes back probably about 10 years now. And some of those lasers were really big, like the size of a big computer. And they were especially good for the arthritic patients and for offering pain relief. And then they've changed over the years. And then when I was able to get the multi-radiance, it was a big enhancement for me because of the portability, number one. So I love that it could fit right in my pocket. I could go with it room to room. And I especially started using it on my extremity patients. It was very easy for me to get into some of the crevices that I needed to get into. And it was also particularly easy for me to stay within, my core concepts of being able to teach patients movement. So here's a device now that I could move around with them while I'm instructing them in either, Eldoa type of fascial stretch work, or giving them some strengthening or reawakening exercises with the laser enhancement at the same time. So that was, one of the things that I really admired about the design, that I'm not hooked up to anything now. That portability was really fantastic. I take this home every weekend with me.
I love it because it allows us to engage the patient also a little bit more than just the adjustment. As you know, people are obsessed with technology, but we have a technology that has a lot of peer-reviewed studies, that has been proven to be effective, that has been proven to be safe. So tell me a little bit about what you envision the future of laser therapy with chiropractic care. What would you envision, especially when it comes to rehab?
So it's remarkable to me that not every doctor has one yet, right? With the accessibility, it's easy to get, they're affordable, they fit in so well with whatever your practice is. I don't want a doctor to change, what their core, concepts are, what their, if they're doing adjustments only. This is going to make their practice, better in regards to patient outcomes, help them get better faster. So really looking ahead in the next 3 to 5 years, I really hope that every practitioner has a laser. And this was such a great entry point to start using, right away. You get to have it shipped to you. You can learn how to use it online. You can start demonstrating it to patients and working with them and experimenting right away. And there's definite protocols, that will help guide a person along. So I am an early adopter of technology. And I think that, if your practice is just pain management, if you're trying to optimally load the patient, with stretching and strengthening, any of your other instruments that you might be using, whether it's the Graston or Factor or the T-tools, any of these tools as well, whether you're having a conversation about, energy with your patient, whether it's diet and nutrition, this has a place for them. There's in every category that we would talk to our patients about, whether it's digestion or aesthetics or longevity, this really has some fantastic capabilities. So really every chiropractor should have one of these now.
It's interesting because, as you know, I love chiropractic. I mean, to me, to this day, still feel that the greatest honor that I can be asked is to deliver an adjustment on a human body.
Yes.
Yes. No matter, it doesn't get old. I'm going on 30. I'm not 35 yet, but actually this year, September 19th, I will celebrate my 30-year of graduation.
Oh, fantastic. So I hope you're going to do something really special.
Yeah, I'm super excited. But I know that, you have a tremendous passion for rehab. And I know also that one of the fundamental functions of SuperPulse laser is rehab. Now, there's a lot of chiropractors out there that are doing rehab, and they've been trained by you and your counsel in a way that is very effective. But there's other chiropractors out there that have not incorporated rehab to the degree that they could, and be able to support those patients and support not only the sports injuries, the work injuries, but so many of the injuries that we're seeing out there. What do you see, or what would you say to them of how the SuperPulse laser therapy can really be an added value to that environment of rehab?
Okay, great question. So one of the things that I think we all do as chiropractors is look for the adjustment. Look for that opportunity to do the adjustment. Always, first and foremost, right? Let's reawaken the nervous system. And I'm gonna say something that could be a little controversial, but I really truly believe that if we take care of the blood vessels will take care of the nerves. So do you see how what I just said? This is helping to take care of the blood vessels. That's huge. They're gonna nourish the nerves. We're gonna do our adjustments, which this combination is really remarkable. And I wanna add something. So I think that all chiropractors, when they're doing their initial assessment or on a visit-to-visit basis, we check range of motion. I think that that's just something that, we probably all do. It's very common ground. I check, everybody's cervical range of motion, when they're coming in. I check their thoracic mobility. I check their shoulder mobility. I check their lumbar spine range of motion. Very easy to do, right? That takes me 2 or 3 minutes. And when I find a restriction, I want to try to unwind why is there limited range of motion? And I say to the patient and explain to them as I'm doing my postural / range of motion evaluation, that's not normal. I let them know that that's not normal. Let's try a couple of strategies to get it back and then never lose it. Do you get that? So my take home message is, let's regain all of your range of motion. The laser helps me do that. The laser helps me do that. Now I've connected, this concept of, okay, if I lose range of motion or if I feel stiff, I better get it back, because if I could have you aging with full range of motion, you're going to age well. And that's really one of my core beliefs. Maintain your range of motion. Don't lose muscle mass as you get older, because as you get older, you get frail. And you get frail, you get older, right? And then problems start. So the laser is useful, especially for those two things. Just plug it into things you're already doing, like range of motion. And I can, demonstrate to patients, look, you're limited, in your cervical range of motion and left-right rotation, let's say, and I can do laser as a standalone, see if I got a change or not. That's remarkable. If I don't get a change or not, I can go in, I can look at, the bony, structures, the joints, make a change there, show them again, I've improved their range of motion, and then they've, connected using, my hands, my tools, whatever it is. And I just say, hey, look, this is great. Let's never lose it. If you feel like you're losing it, get back in here. That's my maintenance care. It's like keeping you healthy. Let's all have a nice health span. That's rehab to me. And then I just make sure that, I'm using the laser to work in this kind of some of these neuroplasticity concepts to target muscles that need reawakening or reanimation, in sending more signals up into the brain, more stimulation. So the light therapy is really remarkable. We're going to learn more and more about it.
Now, tell me a little bit about your thoughts about PenAway as a rental laser. I mean, when I found out that the company Radiance was actually having the first rental lasers that we've had, I got very excited because, as you know, especially during this pandemic, many of the patients may not be able to get to us, or some practices had to shut down because of their particular environment. So tell me a little bit about how you envision, or how do you implement this PenAway laser program that they've created for chiropractors?
So great question. So our office is just going through the process of figuring out like the step-by-step approach to doing that and implementing that. So, but I can tell you with certainty that during the pandemic and when patients were really afraid, and I, in the very beginning, I wanted to limit myself to like only 3, patients a day, because we just didn't know, how much exposure should I have? I didn't want to, spread it around to the patients. So it was limited, to the number of people that I could see, and then, incrementally opened it up. So looking back, I wish I had a dozen of these, that I knew more about the program. So we have to open this up to our patients, because there are many right now that you have to know your risk factor, right? About going out. You have to know, what are your comorbidities? Can you go out? Can you not worry about it? Can you go into doctor's offices? So those patients, they're coming in on a frequent basis, that feel healthy, feel like, they're fine. They're coming in for their regular treatments now. We've got that to where we're almost back up, pre-COVID in our office. But there are many of my patients that are still waiting in the wings, that we have to call them up and say, hey, look, and they've, been staying in touch with me and say, hey, look, we have this available to you. So I think it's going to be really easy for doctors to implement that.
I'm
Great
super excited
suggestion.
because, as you know, many of us have patients that uh, are athletes, and
Yeah,
a lot of times they have injuries, and they want to be able to, if they're on the road or if they are moving around. Some of us are dealing with CEOs that travel a lot, or business
right,
owners.
exactly.
So it's just a wonderful opportunity. But I want to ask you one last question, and that is,
Sure.
do you have like a personal story of how the multi-radiance laser helped you personally, or it helped a member of your family, or maybe a story of one of your patients in which you felt that the laser really helped you achieve success much faster than if you would have done the chiropractic care?
Yeah. Okay. So I have so many, that like really whirl through my head, my mind on that one. So definitely all my tendinopathy patients is really good. It helps me localize it. So patients will come in to the office and we're talking, and, sometimes they're not like clear, or, where they have so many multiple aches and pains, right? Patient comes in and they're like, oh, Jeff, I have an ankle pain, I have a knee pain, I have a hip pain, I have a, shoulder pain, and my neck hurts. And I'm like, okay, take this device and I want you to put it on your number one area where it really bothers you. And the treatment starts right there. So they just helped me identify, right, what is their chief complaint. And then I could figure out, through the fascial chains and watching their movements, where their pain generators are coming for. But it kind of helps bring the conversation like, okay, we're going to use this, put this right on that area is one. But it's been really great for using now for patients in the upper cervical, cervicogenic headaches. It's been really great for migraine type patient headaches, the TMJ patients. And just before we close, I want to make sure that you said something really important, the use of this at home. So I have said many times to patient, look, if you're in this much pain, I need you to come in every day. Like, let's do 5 days in a row. I need you to have a boost. And I think that that's a recommendation that a lot of doctors aren't doing. It's like we're stuck on that, come in, 2 times a week or 3 times a week. No, we need to do this to them on a daily basis. So if they've got this at home, oh my gosh, that's fantastic. I could still, reduce the load in my office, of seeing, patients, get other patients in that need to see me, make their home recommendations, create a home care plan while they're getting in between office visit sessions. How great is that? Right.
You
And
know,
it's a rental, right? So
Yeah, I
I think
love
it's
it
a
because
good thing.
for a lot of chiropractors, it's helped be able to bridge that revenue gap that they had because of the COVID. And,
Right.
and as you were talking, I was just thinking to myself, one of the things that I love about Multi-Radiance is they have the educational components. They have webinars for
Yes.
us. They have all of that online that we can do that. And I know that sometimes you have chiropractors that are maybe thinking about having a laser, or perhaps uh, they have a laser, but they don't use it that much. Uh, what would be something you would tell somebody that's considering adding laser to their practice? What do you think they need to know with certainty?
I think that there's the implementation factor of this is really easy, that patients really like it. And that's important. I know chiropractors are often, slow to, buy something new, to spend money, and they'll look at guys like you and me that'll, or the early adopters will go out unafraid to spend the money because we know that it's going to be worthwhile. That's the right thing to do for our patients. And then a year later, they'll kind of circle back and they'll go, Jeff, are you still using that multi-radiance? I'm like, yes, it's fantastic. And then they might start thinking about it. So I mean, these are tools that, you know, you're going to look back and go, I wish I did this sooner. You know, I get it. And so it's the easy implementation of this, and that patients really do love it. And you're going to see results right away. That's what we want. That's what we really, you know, need for our patients.
Well, you
Let's
know,
make them happy.
I've always said that we got into this to get sick people well. I've always felt like when we get results, referrals happen. It's that simple.
Yeah.
So
Yeah.
we have to keep improving our art, our science, you know, and even our philosophy, because sometimes we have to expand our philosophy to understand a little bit about how to really help a patient. But I just want to take a moment just to say thank you. You know, Jeff, you've been a leader. You've been an amazing individual in this profession. You know, the Rehab Council of the ACA has done such an amazing job in helping so many of us in practice to be able to really serve patients at a great level. So congratulations on your leadership role always. And I just want to say, I really appreciate your time that you're taking with us and educating us as to especially the incorporation of super pulse lasers technology with multi-radiance, because I know that for those of us that use it, it is something that we recognize its value. But there's a lot of chiropractors out there that have not had the opportunity to really use it on a day-to-day basis. And I hope that after this video, they will reconsider.
Fab, and you are doing a great job, and just so remarkable in your efforts and your constant energy that you're always giving. So thank you. And it's great to see you. Great to have a visit with you. Take good care. I'll see you later.
Thank you.
Thank you.